Hello, I'm Ignacio Muñoz. I've dedicated my life to finding treatments for Huntington's disease. I'm also the president of Factor H. Huntington's disease is a fatal genetic neurodegenerative condition that progresses slowly, leading to complete disability and an early death. Towns in Venezuela have the highest incidence in the world. The communities of San Luis and Barranquitas participated in research studies that led to the identification of the cause of Huntington's disease. We owe them a lot, yet today they live in conditions of extreme vulnerability. I'm going to tell you about our ongoing Caregivers program to support Huntington's disease patients in Venezuela. Factor H works through our 4 core pillars: health, community development, youth, and advocacy. We're incredibly fortunate to count with the Habitat Luz Foundation team in Venezuela. They really are a miracle. Social workers, clinicians, psychologists, artists, community leaders, we all work together as a single team. Our most innovative solution is really to be there when nobody else is. When I visited these communities in 2013 and I saw how they lived, I realized I had to do something. We have characterized deeply the families we serve from a medical and socioeconomic perspective. More than 90% of the families live in housing conditions without running water. We have implemented a range of medical and psychological programs for several years to benefit children and patients, and a wide range of humanitarian activities. And now onto our caregiver programs. The caregivers are often the forgotten side victims of this disease, and they carry an immense physical, emotional, and psychological burden. Through our home care program, we are able to assist not only the patients, but also their caregivers in their home. We provide equipment, medical, and educational support for them. And what would we do with the Amgen prize? Well, first of all, our team is small and we need to expand it. We have identified 169 caregivers, 70% of whom are women, and they need training, they need help. We want to continue offering psychological and community support groups and initiate occupational training so that the caregivers can become financially independent. And finally, we want to equip existing infrastructure that we've purchased to be able to provide a safe space for caregivers and patients with showers. Finally, we want to have as much impact as possible throughout Latin America to other communities that have similar characteristics. For that, we want to implement a phone-based application that provides a caregiver's guide in a way that is practical, visual, simple, and accessible. Let's not forget that a new generation of HD victims are children growing up in Venezuela today. Let us help them. Thank you. Thank you for your time.